I think your work comes with trauma. What do you think? What kind of trauma? I do a lot of trauma cases when I was like in Jamaica. Like those are fine, you know, but maybe it's karma. I won't say anything. I don't know. Brutally 17 is asking if I'm Jamaican. Yeah, man, that's home. All right, that's home. Yeah. Oh, I pinned this comment. I don't even know why I pinned this thing, but yeah, but I've seen a few, and it's an eye opener every day. Even now that I'm doing house calls, it's the same thing, you know.
Nurse, it's me in the comment, nurse. Me in the
Well,
comment.
go on. I know you say
Why?
you're going to your bed.
Yeah,
You know,
just seen
sometimes your finger just
6-7 come
accidentally
up,
touch on this
nurse.
thing.
Lord, I'm thinking you'll jam me up. I said, oh God.
Huh?
It's me in the comment in case you miss it.
Oh, is you pin the comment?
Remember, say, you give me headmaster role. Me have to there watch the comment to see where it's one of the trollers them are coming to mute them or, you know.
Yes. You know,
Yeah, and
how many...
if you miss any questions or anything like that, I'll pin it up the top there. Make you stop squinch up your eye. You
Oh,
know
you
what
know
they,
that somebody tell me that I can touch to the left. Is the left, and I can see. But you know, sometimes you just want to make sure you see everything that is coming up on the.
No, because you have to make sure that you look beautiful all the time and looking at
Exactly.
yourself.
Yeah, man. Come want to make sure
That's
it's none
what
of them.
somebody told me, you know.
Here, you know, you're too mixed up. You know. Call to hearts. How are you doing? Yeah, every time I press on this thing, it send out an invitation. But yeah, man, I like to see myself on the screen. Make sure that my eyes them look clean and my teeth them look clean, and you know them way they know when to wipe my mouth and all them stuff there. But yeah, man, overdose. So what area are you in? I'm gonna look at your page. And thank you for liking up the live. I can look up your page here. But how are you doing, Call to Hearts? I think you're probably getting ready to go on to other lives right now. Yeah. So what are you up to for the rest of the evening, Fire? So yeah, so I say I want to pull down my hair and rinse it again, and then probably just do it over a little bit smaller. But I'm thinking about doing the 3-strand plait. And then from there, because I'm not putting on back the braids for a little bit. Yeah, feel like I want to rock my natural hair a little bit more. So that's what I'm gonna do. All right. I'm trying to upload this live for the entire week since when I did the live. I think I did the live on Sunday or Monday. Trying to upload it to YT, and it's like taking forever to do so. Now run gentles, welcome. All right. I'm gonna play my little music in the meantime before I tell me some live boring. Huh? Oh, you know, if you talk about weird stories without revealing identity, it can bring a lot. Yeah, I do share, I do share content on my page. But you still have 1 or 2 persons who will be coming onto the live and wanting to attack you. Not really the live, because I talk on the live, but sometimes I'll share the stories, on my page, and depending on when I see them, because sometimes I'll, do the video, but I don't share them at the same time because you just want it to kind of, move away from that date a little bit. Yeah. And then share it later on. But some persons will be like, oh, you're breaching HIPAA. And I'm like, you can't even identify the patient. If the patient is supposed to see me posting and talking about stories, they can't even say it to them, because sometimes I might use a male, a female, depending on who I'm seeing. If it's a female, I might just change it to a male. The age group is going to be a little bit different or a little bit off. I'm never going to be, giving the exact age. I'm not giving the location. 3/4 of the patient, them don't know my face. You understand? Because every patient that I go into, I wear a mask, and they do see it 1 and 2 times. Like I'll pull it down and be like, "Hi, this is Stacy," and then I pull it back up. You understand? But apart from that, like I'm not giving out anything that will identify, And where I work, the patients, them, they're 1 hour plus hours away from me. You understand? So it's not like I'm in a close, they're very close to me, where if I'm giving out the story, they can say, "Oh, but it's me they're talking." No, you can have something similar to it, but it's not you. You understand? So that's just it. I'm in America. I'm in Texas. Yeah. So some persons are just pretty quick with, trying to blow up this thing when it comes on to HIPAA and violating, patients' privacy rights and all. But I feel as though if I'm providing the content in a context where, it's just bringing an insight, educating, and trying to see how we can improve on certain things, I don't think anything is wrong with it. I'm not trying to ridicule anybody, mock anybody when I talk about my stories. These are just real events that are happening that nurses are experiencing, caregivers are experiencing, patients are experiencing, because some of them relatives, them just, not good to them, them not love them. You understand? But we don't really talk about it. You understand? The only thing a lot of times you hear is that, yes, we burn out, we beat out, we need more money depending on where you're at. The patient ratio is just too much. We don't have any resources to do certain things. And that's it. And you might hear the 1 and 2 stories that, yes, we take care of, this kind of patient and they do appreciate it. But a lot of times, they don't know, you guys don't know a lot of things that are happening behind. You understand? Because often you hear about a relative coming out and talking that, something have changed my mother for the last 2 days, my wait on the nurse. You understand? We don't hear people coming out and talk about those. So what is wrong with when the nurse come and share, their experiences in the home setting or in the hospital setting regarding certain situation that is happening, you understand, with patients and other relatives? Nothing is wrong with it. You understand? It's just that some of us as relatives or as family members, we feel bad now because they are show them up in a sense. Because not saying that you won't realize, but if you know that you have a relative and you're not taking care of them, you're going to feel bad in yourself, because a lot of us are sitting down and waiting for caregivers to come to our house to take care of these patients. And you and I know that even if I am not the person that is seeing your relative, and you have your mother on your bed in a room right now, and you're watching this live, me know you feel bad. I know you feel bad, and that is what it's supposed to do. You're supposed to feel bad to the point where eventually you will go in and you'll turn mama and make sure mama is not getting any pressure ulcer. You're gonna go in and wipe up mama, clean her up, and don't wait until that caregiver comes, because that's the reality of a lot of the patients that I am encountering. They're in a room by themselves, and you have them family on TikTok, YouTube, watching all of those things, giggling, and them parents in the same house not getting any care. You understand? But then when they come to hospital, they dress up real nice, and then they come in the room and be a bother sometimes whenever you don't get 1 and 2 things correctly or done in a timely manner. You don't feed them, in the timely manner. You don't give them the warm blanket. You don't change them, but they don't realize that you have other things doing. But when they're at home with them not really see them not care about them. You understand? So they only come to the hospital and put on this, big show for us to make it seem like, yes, they do care. But enough of them not care. They don't care. You understand? And then they just come to the hospital and make it seem like, they're the biggest fan of those patients and the relative. How you do ease the stress? How me ease the stress? I do work out, even though my belly, my belly not really showed up out there right now, but I do work out. I like to stay active, and I love to stay active. Love window shopping, even though, some days I will probably overshop a little just to kind of, free up my mind a bit. But I like to shop. I love to travel. I love road trips. What else? I just not bring home certain things with me. Like 1 and 2 cases I'll definitely walk home with, because, it touched me that bad. But apart from that, me not make work life, stress out me. Once I step through that door, that's it. Me leave everything behind. As I said, the 1 and 2 cases I walk with are the ones that are concerning for me. And the only reason I'm probably thinking about it is because, sometimes I feel as though my license is on, like, sometimes you just wonder if your license is on the line for something, things like that. But apart from that, dealing with stress, it's more just finding the time, to relax. And that's about it. Do you have nightmares of what you see as a ER nurse? No, dear. As I say, a lot of times, as soon as I step through the hospital door, everything I leave behind me. And it's not like I don't care about what is going on. I do care, I empathize with my patient. And that's just it. But when I, as I say, and the other thing about it, I don't know, probably because, when you just started your journey, you've been seeing a lot of things. Because in Jamaica, I did my nursing. So I'm thinking that, as a student nurse, I think probably at that time I should have, because I saw a lot of trauma cases. And then as you go along throughout your career, after a while, you're seeing them, to deal with them. Yes, you lose some along the way, but no, I don't have any crazy dreams or anything regarding any of my patients or the conditions that I see. I don't hear no beep, 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 beep. Those ICU nurses, no. Yeah, so unfortunately, that's what kept me from being a nurse for a long time. I thought I'm too empathetic, thought I'd take home stuff. No, dear, after a while, once you start, you have to learn how to separate. You understand? And nothing is wrong with separating, the two worlds. But as I say, there are certain cases, I'm not going to say, I don't bring it home with me. They're on my mind, but not to the point where I'm like, having nightmares and freaking out, at home over it. Like, no, as long as I know that I did my best and my best is good enough, that's the most important thing. When I go out there, I take care of my patient, you understand? I treat them as though it's one of my relatives, or I treat them as though, I'm the one that is getting the care. So whatever I'm doing for the patients out there, I do it to the best of my ability. So when I am done, I feel good about it. I close my notes and that's it. I have a sister that works in the ER in the States. She said America is a madhouse. Oh, Lord. Well, as I say, like a lot of things here are, an eye-opener. A lot of things that I am experiencing, like my background, a lot of times we will be having like a motor vehicle accident, your stab wound, your GSW, cases like those. And you might have your little stroke, your cough, your cold, your heart attack, but then the heart attack wasn't that bad, like in Jamaica, your hypertensive cases are there, but we never really used to have like a ton of strokes at those times when I was, there. So it was more, I would say, a lot of trauma. You have a sickle cell patients and all, but then I get here, it's like you see everything, you see everything. And then to top it off, like 3/4 of the patients, they have their underlying, their underlying psych problem, which a lot of times I can deal with it to some extent, but I've never really had that much experience with it, because I don't know if it's because in Jamaica, we don't really talk about, a lot of persons don't really talk about, mental health like that. Mental health, yes, you learn about it in school and you're just thinking about like your bipolar, your schizo patients and all. But in terms of anxiety, depression, we never really focus on that much in Jamaica. And so when you get here, you realize that 3/4 of, like your diagnosis sometimes is related to a psych problem. You understand? The simplest of things, people are going through anxiety, depression, they're taking medications for it, and it's just like a roller coaster of things going on for them. So that's just it. My consolidation was in psych, loved it. Okay, nice. Not my cup of tea there, but I'll treat them. Not my cup of tea, to the best of your ability. I love that. Yes, definitely, David. When you get to use it, I guess it's a different experience. Yeah, so that's just it. But yeah, I don't really make it, as I say, I don't let it be like the pediatric cases, like usually the pediatric cases, if you have a child that died, on your shift, that one kind of touch you a little, extra. But for majority of the cases, you just look at it and say, I've done my best, and That's just it. But, you know, even though, and then the part about it is, you know, most of the time it's the relative as well, because then you're seeing how they are, you know, dealing with certain things and, you know, their response to losing a loved one. That part always tear me up. You understand? So after, you know, just try to, you know, step aside because I can't deal with that part. I cannot deal with that part because sometimes I will be there just bawling with them too. You know, not messing up my makeup too much, but eyes them full of water and you just need to go somewhere else and just kind of tap out for a second. Yeah, especially when it is like not so much for the elderly, because then you're thinking that, you know, they've had their run, you know, in terms of they've lived their life and experienced a lot. So yes, it's a life that is lost, but sometimes, you know, after a while you reach, you know, the Lord decide to take you at that time. If you reach 100, you know, 90s, you know, depending on what is going on with you, you know, so you know, really touch me like, you know, when it is a younger person who you're thinking about haven't experienced life as yet. And especially if it is something that is, they never really have any complication, underlying problems, things like that. And you just see that, oh, this is what is happening. Are you trying? And there is no hope. Then, you know, that brings a little bit of a sadness for the entire shift. And then that's it. Because seeing sadness every day living will have an effect. I cannot be too long in that space. Definitely. Yeah, definitely. But the good thing about it is that, you know, sometimes you have facilities that will go ahead and do like, you know, debriefing. So that kind of helps as well with, you know, persons talking about what is happening or what had just happened, how they feel about the whole situation, you know, how they think they could have done, what they could have done differently if, you know, the situation, you know, presents itself again, or a similar situation presents itself again. So that kind of make you feel a little bit better at the end, hearing how persons are feeling, you know, about the situation, and then from there. So kudos to those hospitals that does that, you know. So do you ever feel like run out the hospital? Nah, like this is too much. Nah. So I'm the kind of person like here in the States, probably if in Jamaica, like, you know, if in Jamaica, and so for example, like while I was in Jamaica, you know, there is not much staff to patient ratio. And at the same time, we lack a lot of resources. I think probably if it was in Jamaica that I was working and we had all of the resources in terms of, you know, the testing and all of those things that are going to be time sensitive, the protocols, the policies, and we still never have enough nurse, them days I think would have run out a long time. Because just imagine if you are the only nurse or two nurses working on a floor and you have 45 patients and you're supposed to be doing everything that we're supposed to be doing for your patients here in the state. Remember, we have like a 4-to-1. Then yeah, man, that would mad you. You understand? So I would have to run out. I would have to run out. But here, so in Jamaica, dealing with, you know, if you're on a floor, 2 nurses, and you have 45 patients, a lot of times you might not be doing like everything because the CT scans, you might not get those, you know, done in a timely manner. So certain things you won't be able to do for your patient. We might not have certain medication that you're going to do like a one-on-one with that patient. But if we had it, then that is a problem. You understand? Because we don't have staff to take care of all of them patients there, much less to do everything that you're supposed to be doing for like your stroke patient, making sure that you're doing those neuro checks, you know, you understand? Make sure you're doing your medications, things like those. You'd have definitely mad out anybody. It would let me run out at that hospital. But now that I got here, I think dealing with the pressure of having so many patients in Jamaica, and yes, I keep up with them, but there are certain things we're not able to do at that time. And even though it was just 2 or 3 persons dealing with so many patients, it was okay, but we did tired. Now I get here, my patient count is like say 4-to-1. So having 4 patients in comparison to probably having 15 patients is a little bit better. But then you have to think about the resources. You have to be doing like, you know, your titration for certain medications because it's available here, you know, like all of those additional things that you have to do in terms of providing the care here for the patients. Because of that, it's a little bit easier in a sense. I hope you understand what I'm saying. It's a little bit easier because you don't have all those patients to deal with, plus all the management for them in comparison to here where you only have 4 patients and you're doing the total care for them. Who else is okay? I'm actually enjoying your questions. You keep talking, I keep tapping. I hope I didn't offend you. I'm just like trying to move. Why are you doing this job? Why am I doing this job? Money drives you. No, I don't think money drives. Money is not the driving factor for me. I love what I do, and that's the most important thing about it. Because if money was the driving factor, then probably I wouldn't be doing. I'll probably find something else and go do. You understand? I probably would have gone and done, the CRNA program. But I just feel as though, even though yes, you make a lot of money, I don't think I would be doing much for my patient in terms of what I really want to do. I want to look at all aspects of the patient, care for the patient on all, the physiological, the psychological, all of those, find out what is there and take care of them. I think with the CRNA, the patient is just lying there sleeping. Yes, we're medicating them and, but the interaction and everything is not there, I don't think you're doing that much for the patient. Yes, you're keeping them alive and you're making those big money, but, kudos to all of those CRNAs out there. But I'm just saying, it's just not my thing. I want to be their advocate for them and try to make a change, basically. I want to try and make a change for a lot of patients as much as I possibly can. All right, so that's just me. And the money I drive me, there is something else out there that is driving me. It's just me wanting to care for these patients and making an impact, make a change in some of these patients' life. And that's just it. You understand? I definitely want money. I want a lot of money, but I'm not going to say that I'm doing this because of the money. All right? I'm not going to say I'm doing it because of the money. Hi, Orville. How are you doing? Where are you from, Overdose? My feeling said the overdose is from Jamaica. You understand? Because of over. So let me just want to find out where you're from. Mia Vinci. Okay. Overdose Suti. I'm if I tell you. But overdo it. Oh, Lord. Over. St. Vincent. Okay. Yeah, that's nice. St. Vincent and the Grenadines. I was looking on the map the other day and realized, help me put today, Overdose, my Vinci Grenada, help me put today, great people. Yeah, I was looking on the map the other day to find out. Like, I know, back in the days when I was in high school, you remember, or is it high school? Yeah, in high school, I remember looking on the map, the Caribbean map. And it was a few days ago, I was looking on the map to find out, where some of our little, because I was saying to somebody that we're just a little dot on the map. And they were like, so what about, Grenada? What would you say about Grenada? And I'm like, oh Lord, I can't even remember which section Grenada is. I know it's like down, like south. And the Caribbean map only has, and that's the only thing we're talking about. I was like, yeah, back in the days, that there are different islands, but then nowadays people just say, are you from the Caribbean? And you say yes, and they just say Jamaica, as if Jamaica is the only place. So we're kind of debating that. Where are you from? And the only thing people can say is the Caribbean, and they say Jamaica, because it seems as though Jamaica is the only place on the Caribbean map. Did you do your graduate degree in the US? Yes, I did. I did it on with Walden. Did it through Walden. Ask anybody in the States. Exactly. They either say if you're from Nigeria, or then they go down and say, Jamaica. They ask if you're from Jamaica. Blessed Kia, welcome. How are you doing? And talk the truth. Rennie, how are you doing? Mr. Rennie can change up our little page, you see. But anyways, how are you doing, Rennie? Blessed Kia, thank you so much for tuning in.
Hi.
How are you?
Good.
Okay. You say you're from Trini?
Yes.
Okay. How are you doing?
I'm good. Just taking a workout.
Huh?
Just having a little workout.
Oh, okay. So you work out every day?
No, 4 times to the week. The days I'm off.
I'm gonna start riding back my bicycle. Yeah, I'm gonna start riding my bicycle and go on to the, and jump up and down. I'm tired. That's what I'm going to be before I go to bed. Okay, that's fine. Well, make sure you go ahead and follow me, and make sure you follow me here on TikTok and also on YT, I think, nursing. All right. And you can come back and ask a bunch of questions again. TS Music Entertainment, welcome, welcome. How are you doing? Yeah, so what are you up to for the room? Are you getting ready for Carnival? Is the Carnival coming up?
No, I'm not going for carnival this year.
Oh, okay. Because I know a lot of persons are preparing themselves for Carnival. Mm-hmm.
No, I'm not prepping for carnival.
Okay. It's just your regular thing.
Yes.
Okay. So you say you're a nurse, right?
Yes.
Okay. So what kind of nurse are you, if you want to?
Started off on labor and delivery, but now I'm antepartum.
Okay. What's your ratio like in terms of like on the floor?
1 to 3.
Ah, okay. That doesn't sound bad. Because 1 to 3, that's antepartum. Okay.
Labor 1 to 2.
Mm-hmm. Is that the normal ratio for your antepartum? That sounds pretty easy.
Yeah, it's doable.
Yeah, because the only thing you're gonna be doing extra is the fetal heart tones monitoring.
Yes.
Not like the postpartum. So with postpartum, how does that one go, like in terms of the ratio?
They try to go 1 to 4, sometimes 1 to 3, dependent on the amount of patients and the amount of staff.
Oh, okay. And then with the postpartum, that is inclusive of the mother and the baby.
Yes.
Oh, so one nurse is having roughly 6 patients.
Yes.
Well, not enough fear. That's not fair. Okay. So how long have you been working as a nurse?
I've been a nurse overall 16 years. In the US, this is my 2nd year.
Okay. So you've been always in labor and delivery?
Yes, and antepartum.
And
Yes.
okay. So you have to have do you have your midwifery certification, or what are your certificates you have to have?
Well, I had to have my bachelor's degree, which I had from back home, and I was a midwife from back home, so I presented that as well. But the system in the US is a bit different because it's not really needed.
Mm-hmm.
Delivery.
Yeah, because I know a few persons from back home are nurse midwives, and they're not able to practice here in the States.
Yeah.
So a lot of them are working in the labor and delivery as, like, what you say, regular nurse, but they're not using up their. Okay. So are you planning on doing the midwifery program here in the States?
No, thank you.
What? You're planning on doing your master's then?
I have my master's already in public health.
Oh, okay, nice. So tell me a little bit about that. I've never really spoken to anyone who is doing public health here in the States.
I did my master's in public health back home, so I plan on basically transitioning from the bedside to either public health nurse or case management.
Okay. That's not bad. So you did the program. You say, was it an online program or in person?
In person with University of the West Indies.
Oh, you did it by UA
Yes.
in Jamaica?
No, Trinidad.
Oh, the Trinidad. Okay. So in terms of the clinicals, how was the clinicals? Like what it entails, if you don't mind.
Well, you'll have to go to different health facilities, and for example, you have to choose a public health concern, and you'll do your thesis on that. So at the point in time when I was doing mines, it was the rainy season, so leptospirosis was indeed high and a factor. So that was one of the things I looked at. The other part was vaccination, because I'm also a district health visitor from back home.
Okay, nice. You have a lot of background experience there. So in terms of there was something I was going to ask you. Did you have to do your midwifery before getting into public health?
I was a midwife before. I don't think it was a requirement.
Okay, because I know in Jamaica, I think that's a requirement. You have to have your midwifery. I think you have to also do psych. Those 2 certifications before you actually get into. Mm-hmm.
Get into to become a district health visitor, I had to have midwifery before.
Okay, 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 okay. Nice, that doesn't sound bad. I wanted to do public health at one time when I was in Jamaica, but then, I would have to do midwifery, then psych, and that was just gonna take a little while because you have to have 5 years experience, nursing experience. I don't know if things have changed, but I know at that time that was a thing. You have to have your 5 years nursing experience, midwifery, psych, and then you can go and do your masters. I don't know if you wanted to do it. Yeah, it was just a thing. The thing, whether or not it is private or public, that was just it. But I never got the opportunity. I took the opportunity to,
Exit.
jump over. So, were you on a recruiting company when you got here to the States?
Yes, I was.
Okay. How
One
was?
second,
You're
please.
good. You're good. In the meantime, welcome everybody. Raphael is asking, where am I from? I'm from Jamaica. Thank you so much for tuning in and following. All right. Where are you from, Raphael? Max 700, Lati 0927. Welcome. Douglas Hall, welcome. Yeah.
Yes, I used a recruiting agency. It was just easier for me.
Hold on 1 minute. All right. And sorry about that. All right, let me do this thing here. So yeah, what were you saying now? My bad.
So I use a recruiting company. I use OGP.
Okay, how was it with them? Because I know I have a few persons who didn't have a really good experience. How did you find their?
They were on top of it for most parts. There were parts that you really needed to push for, as I always tell nurses. One of the things that I ensured is that I didn't accept something that wasn't going to work for me and my family.
Okay.
Anything they try to tell you or try to sell you a state that you did your research on and you know, this state is not going to work for me or my family.
Okay. And they were pretty open with, or you had a fight in terms of trying to go to the place where you want it?
I actually interviewed for a few places well because I did interviews and I didn't like some of the areas and I was like, it don't make sense I'm saying yes to something just for the sake of saying yes because me migrating wasn't because I was struggling back home or I just wanted something new. I was had a good job, good position, making good money. I just wanted something new for myself and my children. So I opted to do this. But to say I'm doing it because you're in a difficult place, a hard place, and you just want to get out. That wasn't my situation. So
You had a little time to play around with them. Okay, that makes sense. So for all the persons out there, if you're pretty comfortable in a sense, still
yeah,
play around with the companies and try to figure out if you really want to go to some of the locations and then try to, talk with them. Let them know where you want to go. All right. Okay.
they worked with me and they were like, okay, let's see if we could get you to where you want to go. So I had narrowed it down to Texas and Connecticut.
So where did you land?
Texas.
You're in Texas?
Yes.
Ah, that's where I'm at.
Yes.
Okay. Well, hopefully one day we'll meet.
Yes. I'm in Houston.
Oh, you're in Houston. I'm in the Dallas Fort Worth. Yeah. Okay. So you love it in Houston?
Yes. I do.
Okay. Okay. Yeah, I've been to Houston like twice, and that was it. Uh-huh.
I would
Okay.
tell persons, do your research. It requires you doing your research and knowing what to accept. And if
Mm-hmm.
there are things that I disagree with the way the company operates or the way they do certain things,
Mm-hmm.
it's not that bad. And my contract is almost complete. By next year, my contract is complete. So
Okay. So how long is your contract?
it was 2 years and 3 months.
Okay. Are you able to do overtime in order to complete it?
They will only take 4 hours from the overtime. So let's say my typical work week is 36 hours. But if I do pick up overtime, they will just take 4 hours from that 48-hour work week.
Mm-hmm.
Just
And
take
put
4 hours.
towards your contract time?
Yes.
Okay.
Yeah.
Okay.
You do get to finish off a little earlier once you do the overtime.
Okay. Okay. I wish they would have opened it up to say, okay, then any amount of hours, because that was what I did with my company that I did got recruited through. Like any amount of hours you did, all of it goes towards your contract hours. So this girl was racking up like 60 hours per week, some weeks, or some days I'll be just putting those overtime because every hour count, and that was just it.
I would have been doing that as well.
Definitely. So how was your transitioning period? What was it like? Did you think it was difficult, or how did you find it?
It wasn't difficult because I was used to traveling and spending certain periods, but I guess the agency to a point made it easy because I had a liaison person that settled us in for the first week, took us around to get things done, like help you get your vehicle, settle out with the bank. So those aspects were easy, but in terms of literally just adapting to the culture,
Mm-hmm.
and we from the Caribbean, so we tend to be polite. So we would be good morning, good evening,
Mm-hmm.
realizing that a lot of these persons, there's no good morning and there's no good evening. Like
Yeah. Yeah.
that was part of a culture shock for me.
Uh-huh.
Just having to learn to adapt to that, having to adapt to the fact that there's a lot of microaggression in the work,
Mm-hmm.
given especially that you're non-American black person in an area that is predominantly not for us.
Mm-hmm.
Those are just some of the things. I mean, I had my moments where I broke down and I asked God, is this for
If
me?
this is something really you
Yes,
wanted, I totally understand. I think that is one of the biggest cry with a lot of immigrants or international nurses when you talk with them, that breaking point.
yeah. So silence became my biggest friend.
Thought I was the only person. Yeah,
So
just
silence
listen.
was good for me. So then they started to complain that I was too quiet because
Uh-huh.
they were like, you would be speaking to her and she wouldn't answer. So one day a manager was like, why don't you answer? I said, because I don't accept the fact that people speak to you like you're their child.
Mm-hmm.
So silence is better than me responding in a manner that they would assume rude.
Because then when you answer, you're gonna be you're gonna have a tone. Yeah, the nurse with the tone. Yeah. So I thought I was the only person there. Yeah, after a while I was like, okay then, you just talk, I'll just listen. And then if I feel like I just do, otherwise, you just go through this one and come through the other one. That's
Exactly.
just it.
That's how I operate. That's how I
Ex-
maintain my peace. But
Exactly.
all in all, so far, I can't complain. Um, I'm enjoying it.
Okay, that's nice. And especially
So,
when you're finished, yeah, you're gonna rejoice. Because now you have the
yes.
flexibility and everything, so you're gonna feel good about it.
But so far, it's so good.
Huh?
But so far, it's good. And I would encourage any nurse that you want to give it a try, give it a try. You have nothing to lose, like nothing.
Yeah. So in terms of the compensation, a lot of times we tend to complain that, oh, the recruiting company not paying us good. In terms of like, what they pay you and what they did for you, do you think it was a fair trade-off?
For me, being here so far, I would say yes. Because I look at it, I use the measuring stick of if I was back home, would I have saved the amount that I have saved within the year and a half that I've been here so far? And my answer was honestly no.
Okay.
So if I were to pack up and say go back home tomorrow, I would be going back home with a lot more than I came with.
Okay. So what about in terms of the processing, the paperwork processing and all? Do you think if you were back home, you think you'd have done that in a timely manner? Do you think you'll be able to, would have navigated properly, getting those things done to head over?
I don't think so. I think the agency made it a little because I have colleagues who tried it on their own, and the amount of stumbling blocks that they were met with, I was like, no. So let me give you a little rundown. My daughter, when my immigration papers came through, everyone was listed. My husband, my daughter, my two sons. But when we got to the embassy appointment, the person told my daughter she wasn't eligible because she just turned 21.
Oh.
But the thing about it, the caveat was I paid for her visa since she was 18. Then COVID came, so they said, and I think if I was doing it on my own, I would not have been able to navigate that part. However, my agency stepped in and they were like, no. She paid for it since the child was 18. There's no way she reached out. And they got a lawyer to review, and within a couple of days,
You got approval. Yeah, and that's the good thing about the agencies. Even though yes, we want to do it, there's so many paperwork and all. A lot of things we wouldn't be able to independently do for ourselves, and that's so that aspect of everything works out in our favor. So that's why I would say, it's only gonna be a contract that is 2 years long. Whatever they're doing, yes, it might seem like it's only worth a 6 months repayment, but think about all the things that they're doing in terms of the time that they're spending, advocating, trying to get certain things approved in a timely manner. So I think it was a fair trade-off for me, even though a lot of persons probably complain that the rate wasn't, but it's only for a time period, Just look at the bigger picture, the end result, and the opportunity that you're going to be having. So.
Because I don't think I'd have been able to navigate that part because when it comes to interacting with immigration officers, they have this standoffish approach. They have the approach that the information they give to you is you do all and end all. I reviewed it. I said she doesn't qualify and she doesn't qualify. Nobody was willing to give you a listening ear. And the only time I saw a solution was reaching out to my agency, and they were like, no. They highlighted the part of the law that the officer was misinterpreting, and she got her interview.
Okay.
That's a win.
Okay. Hi, Kerry. Kerry's asking, did you stay there full length of your contract? For me, I did. Did you? Well, blessed Kia.
Yes, I would be staying the full length of my contract. I'm already a year and a half in. Why not?
Yeah. Yeah. What facility is it? Is like a level 1, 2, what
So everything comes to my facility.
Okay, so level 1.
Everything, yeah.
Okay. All right. That doesn't sound bad. So how did you find the charting system?
At first, it was kind of difficult and not just understanding on where to go into document what. Because coming from the Caribbean, we are accustomed to paper-based. But once I established my way, so I had a notebook and I took notes like, okay, to go into chat my morning assessment, I needed to go to, we had something called the brain, or you needed to, I put like little points to enter the brain, and from the brain, and after that I didn't need the book.
Yeah. And that's what I tell people, like, start out with your little notepad, Nothing is wrong with it. Some people might see us being smart. Some people might see us being slow. But regardless, you have your way of doing things. And once you catch on to certain things, it will just work out in your favor. So start off with your little notepad and just try to keep organized. And at least you won't have to bother some persons. Like, every time you're trying to find out, where do I put this? Where do I find this? Things like that. Just write down in your little notepad. Keep yourself organized and you should be good. That was just me.
So now it's like they actually changed the system to something new again, and it was like same process all over again. But at the end of the day, so well.
Yeah. And then it's not you alone that is going to be learning this new system. It's everybody. So, you don't have to feel like, okay, then you're not getting it. It's everybody that is going to be struggling with this new one. What system were you using?
This one was sooner, and now we're using Epic.
Oh, you're going to love it. You're going to love it. I don't think there was any significant change when I, started with Epic. Yeah, it was pretty easy and I love it. Huh?
I actually like Epic.
Yeah, I love Epic.
It's a little more straightforward than Sooner.
Sorry now. Yeah. Romaine, hola, how are you doing? Angela Elliott, hola, welcome, welcome, welcome. Kerry.
So thanks for having me. I'm going to complete my workout.
All right, no problem. Thank you for coming on.
You're welcome.
All right, bye. All right, so you hear that from the horse's mouth. All right, another nurse sharing her story with the transitioning transitioning to the States here with a recruiting company. So as I say, yes, I know we want to be independent and we want to be very flexible when we get here, but sometimes the recruiting company just makes it a little bit easier for us. So definitely think about it. You have the direct hire that you can also do, but sometimes you might be, just left hanging because you don't have anybody that you're, able to contact like whenever you feel like to ask certain questions. And I think probably a lot of the paperwork, you will be the one that is processing it. So when you have the recruiting company that is able to do certain things, you're just going to be like, if they request something, you provide it for them and that's it. You understand? So it makes it a little bit easier, just that the rate is going to be a little bit less because of the middleman, there. But yeah, it will work out. And I guess, if you are strong enough to do the direct hire and you really want all of that money that they're going to be offering you because there is no middleman such as an agency and you might have the flexibility, then kudos to you. Take up the opportunity and do it. You understand? But for persons who are not that's, flexible, you have so many other things dealing with and you want somebody to, be there for you, do all of the work for you, then the agency is going to be the one that is the best choice. All right. But anyways, I did say I was only spending 1 hour. It is 7:59. All right. Gonna go to my bed. And then I'm gonna go to church tomorrow. Yeah. And then from there, Overcomer, Chevy, welcome, welcome. All right. So until then, remember to join me in the week. Follow me on YT. All right. At Think Nursing. Check out my videos. All the lives will be posted over there. And you can ask me any question. As I say, I'm a nurse. I work in the emergency room. I'm a nurse practitioner doing house call service. And I share just about everything regarding nursing, travel, and lifestyle. Mostly nursing, you understand? But yeah. And I'm talking with the nurses just to hear their day, their stories, transitioning experience, just about it. So feel free to follow me on TikTok here. If you haven't followed us yet, let's be friends. All right. And you can, I'll check out your page as well and share your content to other persons out there, even if your page not really interests me like that. But I definitely will engage with your page because that's what TikTok is all about. It's all about you win, me win, as long as you're posting content. If you're not posting any content, if you don't have a name, if you don't have a face, there's a high possibility I won't be posting. I won't be like, reposting anything for you. All right. Because obviously you don't really want anything to do with TikTok, but you have persons who are creating their content. It might not be my content, but if I share it, there might be somebody in my listing that loves your content. So I definitely will go ahead and do everything that the algorithm says. Like, share, repost, leave a little comment. What else? Favorite. Yeah, man. Just do that for a few persons and build your page. And me build yours. I'll build mine in the meantime as well. All right. Wash Belly. Wagwan. Simple Baker. Hello. Anthony Stephen. Purpose Child. All right. Just if I continue with calling everybody's name. Welcome, welcome. Purpose Child. Thank you for the follow. I will not be off of TikTok. All right. So enjoy your evening and we will see you, or I will see you next video. All right. Thank you so much. Not a problem. All right. Enjoy your evening now. All right. No problem.